So, hello students. Am I audible? So, let us start with the upper limb. Uh, a short time, I'll try to cover most of the topics in this. I'm audible now properly. Okay. So, let us start. Let us start the upper limb today. Okay. Have a look at this model. What are important from exam point of view? I'll tell. It will be a quick revision. Just sit back, relax, and listen to the lecture. All this will be available for you. Okay. Hello to all of you. And now we begin. Okay, this muscle, pectoralis major. What is the origin of this muscle? It begins from the medial two-thirds of the clavicle, half the breadth of mandible sterni, the body of the sternum, the second to sixth costal cartilages, and there's a muscle of the abdomen here. What's that? External oblique aponeurosis. External oblique aponeurosis. So, origin of pectoralis major, the medial two-thirds of the clavicle, the mandibular sterni, the body of the sternum, the second to sixth costal cartilages, and the external oblique aponeurosis. Now, where is this muscle inserted? That's the humerus here. This muscle is inserted on the lateral lip of the bicipital groove. The lateral lip of the bicipital groove. Okay, I'll ask you some questions in between. If you can answer, you answer that. Which muscle is attached to the medial lip of the bicipital groove? Yes, come on. The muscle attached to the medial lip of the bicipital groove is? Good evening, good evening. Hi Rishi. The muscle attached to the medial lip of the bicipital groove. Come on. Whatever you can, you please answer. So let it be an interactive session. The muscle attached to the medial lip of bicipital groove will be the teres major. Lateral lip of bicipital groove, that's the pectoralis major. The medial lip of the bicipital groove is the teres major, and in the bicipital groove is the latissimus dorsi. Latissimus dorsi. The origin is here. The insertion is on the humerus. When this muscle contracts, what does it do? So, what is the action of pectoralis major? It takes the arm towards the body. That's adduction. It takes the arm forwards. That's flexion. And it also turns the arm inwards. That's medial rotation at the shoulder joint. So, action of pectoralis major, adduction, flexion, and medial rotation at the shoulder joint. This pectoralis major is supplied by two different nerves. One is the medial pectoral nerve and the other one is the lateral pectoral nerve. And when a muscle receives nerve supply from two different nerves, we call this muscle as a composite muscle. Composite or a hybrid muscle. Composite muscle or a hybrid muscle. Here, about the pectoralis major. Fine. Okay. Just one moment. Tell me, what is attached here? What is attached to this? This is the lesser tubercle of the humerus. We just finished this. What is attached to the lesser tubercle? The muscle is subscapularis. Subscapularis, the action of subscapularis is medial rotation at the shoulder joint. This is the greater tubercle. Three muscles attached here. One is supraspinatus, the second is infraspinatus, and the third one is teres minor. Teres minor. Action of supraspinatus, it does abduction from 0 to 15 degrees. That is initiation of abduction, 0 to 15 degrees of abduction. And what is the action of infraspinatus and teres minor? It does lateral rotation at the shoulder joint. The subscapularis does medial rotation, supraspinatus does abduction, infraspinatus and teres minor does lateral rotation. Together, these four muscles are known as rotator cuff muscles. Rotator cuff muscle. Okay, we'll come to that later. Now, this is the fascia, and this fascia lies deep to the pectoralis major. What is the name of this fascia? The clavipectoral fascia. Clavipectoral fascia. Where does this clavipectoral fascia begin from? Where does it begin from? It begins from the clavicle, and it is inserted into the axilla. Begins from the clavicle, inserted into the axilla. There are two muscles enclosed by this clavipectoral fascia. Two muscles are enclosed by this. The first muscle is the subclavius and the second muscle is the pectoralis minor. Pectoralis minor. So two muscles enclosed by the clavipectoral fascia, the subclavius and the pectoralis minor. And what are the structures pierced by the structures piercing the clavipectoral fascia? What are the structures piercing the clavipectoral fascia? Yes, number one, I'll just point it out for you. Number one, yeah, what is this vein? The cephalic vein. Cephalic vein. Number two is this artery here. What is this artery here? That's the thoracoacromial artery. Thoracoacromial artery. Number three is a nerve here. That's the lateral pectoral nerve. Lateral pectoral nerve. And number four are the lymphatics from the breast. Lymphatics from the breast. Clear? So clavipectoral fascia begins from the clavicle, inserts into the axilla, encloses two muscles, the pectoralis minor and the subclavius. Structures pierced by the clavipectoral fascia, the cephalic vein, the thoracoacromial artery, the lateral pectoral nerve, and the lymphatics from the breast. Lymphatics from the breast. Clear, students? Very good. Now, just tell me, this can come as a visual for you. What is this muscle? That's the deltoid. What is this muscle here? That's the pectoralis major. What is this groove known as? That's the deltopectoral groove. Deltopectoral groove. Between the deltoid and the pectoralis major, there's a groove named the deltopectoral groove. Deltopectoral groove. And who lies in this deltopectoral groove? Hello, hello. Who lies in this deltopectoral groove? Any guesses? Come on, students. Structure lying in the deltopectoral groove. A very important MCQ for you. You can see the structure here. Bolo, 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 bachcho. Structure lying in the deltopectoral groove. Come on. You can answer this. The cephalic vein. Cephalic vein. So cephalic vein lies in the deltopectoral groove. The same cephalic vein is going to pierce the clavipectoral fascia, and this cephalic vein is going to open into axillary vein. It opens in the axillary vein. Yeah. So just try to understand everything that I'm telling you. Listen to the lecture. Okay, many of the things would be clear. I'll try to correlate many things. Okay, coming to this clavicle, clavicle. If you can quickly tell me clavicle. I'll just make the slide for you. This is the clavicle here. So the anterior 2/3 is convex. In its medial 2/3 is convex anteriorly, and lateral 1/3 is concave anteriorly. Yes. So what is the muscle attached here? The muscle attached here, if this is anterior and that's posterior, we'll take the bones separately in the last lecture. So the muscle attached here to the anterior aspect of the medial 2/3, that's the pectoralis major. The muscle attached here to the lateral 1/3 is the deltoid. Yeah. The muscle attached here to the posterior 1/3. What's this? What's this? That's the trapeze. That's the, yes, any guess? Trapezius. And the muscle which begins from here, a muscle which has got two heads, the sternal head and the clavicle head. What's that? Sternocleidomastoid. So that's the sternocleidomastoid. And there's a groove here on the inferior surface. There's a groove here. That's the groove for subclavius muscle. Okay, the groove for subclavius muscle. So that's about the clavicle, the important muscle attachments on the clavicle. We'll be taking the bones separately, bacho. So just try to understand this. Coming to this side, if you can quickly tell me, that's a scapula here. A quick go through the scapula. That's a spine and that's the acromion process. So this is the dorsal aspect of the scapula. Dorsal aspect. So what is the muscle attached to here? This fossa is the supraspinous fossa. The muscle attached here is the supraspinatus. The muscle attached here in the infraspinous fossa is the infraspinatus. Infraspinatus. The muscle attached to the inferior border of the spine and to the lateral border of acromion. What is this? Hi, all of you. The muscle attached to the inferior border of the spine and the lateral border of the acromion. What is this muscle? That's the trapezius. Trapezius. The muscle attached to the superior border of the spine and the medial border of the acromion. Okay, so this is the deltoid. Sorry, this is the deltoid. Number 3 is the deltoid. I'm so sorry. Yeah, this is the deltoid. Yeah, so the muscle attached to the inferior border of the spine and the lateral border of the acromion is the deltoid. The muscle attached to the superior border of the spine and the medial border of the acromion, this is the trapeze. Okay, that's the trapezius muscle. Very good, very good. What is this muscle attached here to the lateral border of the scapula? Lateral border of the scapula. I just put numbers here. This is number 4. What is this? Teres minor. Teres minor. And what is this number 5? That's the teres major. Teres minor, teres major. Right. What is this muscle? a quick go through the scapula. What is this muscle? From the superior angle to the spine, this is the levator scapulae. Opposite to the spine, that's the rhomboides minor, and below the spine, that's the rhomboides major. And there's a small muscle here, that's the latissimus dorsi. Latissimus dorsi. Okay, so the important muscle attachments on the scapula. Again, I'm telling you, bone will be taking separately. I'm just telling you. So if that's the costal surface of the scapula, that's the coracoid process. What is the muscle attached here? That's the subscapularis. Subscapularis. Okay, what is the muscle attached to the infraglenoid tubercle? That's the long head of triceps. The muscle attached to the supraglenoid tubercle, that's the long head of biceps brachii. The muscle attached to the coracoid process are three muscles. Are two muscles. One is the coracobrachialis, and the second one is the short head of biceps. Coracobrachialis and the short head of biceps. Now, what is this muscle attached here? Here. On the costal surface, medial border. Any guesses? Come on, students. Costal surface, medial border. What is this muscle? Yes, costal surface, medial border. That's the serratus anterior. Muscle attached to the costal surface, medial border is the serratus anterior. Very good. Very good. So, coming to the next muscle. What is this muscle? This muscle is the deltoid. Deltoid has got three types of fibers. The one which begins from the clavicle, these are the clavicular fibers of deltoid, or the anterior fibers of deltoid. The one which begins from the inferior border of the spine, these are the posterior fibers of the deltoid. And the third fibers which begins from the acromial process. What are these fibers? These are the acromial fibers of deltoid. So anterior fibers, posterior fibers, acromial fibers. Anterior fibers begins from the clavicle. The posterior fibers begins from the inferior border of the spine, and the acromial fibers begin from the acromial process. Very important person, deltoid. What is the action of the anterior fibers of deltoid? They do flexion and medial rotation. The posterior fibers, they do extension and lateral rotation, and the acromial fibers, they do abduction from 15 to 90 degrees. Right? Which is the nerve which supplies the deltoid? Axillary nerve. Let's say axillary nerve supplies two muscles. One is the deltoid, the second one. Come on, answer this. Axillary nerve supplies two muscles. One is the deltoid, the second one is... Answer, I'm waiting. Yes, the teres minor. Deltoid and teres minor. And the axillary nerve gives a cutaneous branch. What is this cutaneous branch going to supply? It supplies the skin on the upper lateral aspect of the arm. The skin on the upper lateral aspect of the arm. That is known as the upper lateral cutaneous nerve of arm. So understand this. Axillary nerve supplies deltoid, teres minor, and gives a cutaneous branch, the upper lateral cutaneous nerve arm. Injury to this nerve leads to loss of sensations of the skin on the upper lateral aspect of the arm. What do we call this as? The regimen batch sign. Fine. So just remember this axillary nerve, because this axillary nerve gets involved in Erb's paralysis. Okay. So axillary nerve supplies deltoid and teres minor. So in Erb's paralysis, deltoid is paralyzed. So abduction is lost. So the arm is adducted. Teres minor is paralyzed. Teres minor does lateral rotation. So the arm is medially rotated in Erb's paralysis. What happens? Arm is adducted, arm is medially rotated, plus there is regimen batch sign. That's involvement of axillary nerve. Okay, we'll see the Erb's paralysis later. Fine. So that's about the deltoid. You can see the pectoralis major. You can see the structure here. That's the cephalic vein. Perfect, students, clear? Now, what is this muscle which arises as digitations here? A muscle which arises as digitations from the lateral aspect of the ribs. Yes, wait a step hand. A muscle which arises as digitations from the upper 8 ribs, from the lateral aspect of the upper 8 ribs. It arises as digitations. What's that? Serratus anterior. That's serratus anterior. Where is the insertion of serratus anterior? It gets inserted on, what is this surface of the scapula? This is the costal surface. Which border is this? That's medial border. So costal surface, medial border. Nice, Najid. So serratus anterior begins from the lateral aspect of the ribs as digitation's upper 8 ribs gets inserted on the costal surface medial border. When this muscle contracts, it is going to pull the scapula forwards along the chest wall, and this is what we call as protraction of scapula. Protraction of scapula. Clear? Hello? Is the voice clear now? Protraction of scapula is done by whom? Serratus anterior. Serratus anterior also does abduction above 90 degrees. What do we call this as, bacho? Overhead abduction of arm. Now see, abduction from 0 to 15 degrees is done by whom? Supraspinatus. 15 to 90 degrees is done by deltoid, acromial fibers of deltoid, and 90 and above is done by 90 and above is done by serratus anterior, trapezius, and the lateral rotation of scapula. Serratus anterior, trapezius, and the lateral rotation of scapula. That's overhead abduction of arm. So what is the action of serratus anterior? Very important, bacho, very important. Serratus anterior comes as a short note for you. So origin, I've told you, insertion is on the costal surface, medial border. Action is it pulls the scapula along the chest wall. That's protraction. Second, it also pulls the arm up. That is overhead abduction of arm along with trapezius. Yes, and the lateral rotation of scapula. Now, what is the nerve supplying the serratus anterior? That's the long thoracic nerve, or the nerve to serratus anterior, or the nerve of Bell. The root value is C5, C6, C7, and injury to this nerve would lead to winging of scapula. Winging of scapula, right? So what happens is the medial border of scapula becomes prominent. That's winging of scapula. But yes, winging of scapula is caused due to paralysis of two muscles. One is the serratus anterior and second is the trapezius. Now, how do we differentiate this? So we tell the person to go and touch the wall. So when the person begins a movement, when a person attempts a movement and there's winging of the scapula, yes, this is due to paralysis of serratus anterior. So winging on attempting movement, on beginning movement, serratus anterior, paralysis. And winging at rest, the person is at rest, not doing anything, the person is at rest and still there's winging, that's due to paralysis of trapezius. So just remember this, you get visuals on this. OSPI mein ye question aata hai, winging of scapula is shown, the person is performing some movement, that is because of paralysis of serratus anterior. And second person is just sitting, winging at trapezius. Perfect. Serratus anterior is also known as boxer's muscle. Very good. Hello. Very good. Very good. Very good. Fine. Now, I'll just draw one slide for you, but you must have seen the slide. You tell me this is the manubrium sterni. That's the body of the sternum. Okay. This is the clavicle in front. Clavicle. That's the scapula from behind. That's the superior border of scapula. This is the humerus here. And this is the first rib. Okay, so this area is the axilla. Okay, so what is this in front? Clavicle. This is the scapula. That's the humerus. This area is the axilla. The anterior wall of axilla, the anterior boundary of axilla is formed by pectoralis major, pectoralis minor, and the subclavius. Pectoralis major, pectoralis minor, subclavius. But sure, axilla comes as an LAQ. So anterior boundary is formed by pectoralis major, pectoralis minor, and the subclavius. The posterior wall of the axilla or the posterior boundary of the axilla is formed by, come on, if anyone can answer this, three muscles forming the posterior wall of axilla. Anyone? Three muscles forming the posterior wall of axilla. The first one, subscapularis. The second one, anyone? Answer this. Subscapularis, uske niche teres major, and below the teres major is the latissimus dorsi. So subscapularis, teres major, and the latissimus dorsi, these three muscles together are going to form the posterior wall of axilla. Very good, very good. Excellent. So the anterior wall of axilla is formed by pectoralis major, pectoralis minor, and the subclavius. Excellent. The medial boundary of the axilla is formed by what? These are the ribs. And the muscle which begins from the ribs as digitations, what's that? Serratus anterior. So medial boundary is formed by the ribs and the serratus anterior. The lateral boundary is formed by the humerus. So this becomes the axilla. Now what is this, bacha? What is this known as? Look, what is this area known as? This is what we call as the apex of the axilla. A very important MCQ for you, bacha. Very important MCQ. This is also known as the cervicoaxillary canal. Cervicoaxillary canal or the apex of the axilla. Yes, clavipectoral fascia भी आएगा उसके साथ. Yes, because pectoralis minor है ना, तो yes, so clavipectoral fascia. So what is this? This is the cervicoaxillary canal. You get MCQs on this. Boundaries of cervicoaxillary canal. Anteriorly is the clavicle. Posteriorly is the scapula, the superior border of scapula. Medially is the outer border of the first rib. Correct? Outer border of the first rib. So this is what we call as the apex of the axilla or the cervicoaxillary canal. Cervicoaxillary canal. Now, what are the structures which are entering into this? So, bacha, what is this behind the manubrium sterni? That's the arch of aorta. Arch of aorta. And what is this artery which arises from the arch on the left side? That's the subclavian artery. The subclavian artery crosses the outer border of the first rib. Ab ye banega. What is this now? The axillary artery. The axillary artery enters the apex and now comes into the axilla. Dear students, how the subclavian artery has become the axillary artery? So subclavian artery arises from the arch on the left side. On the right side, it arises from the brachiocephalic trunk. Both the subclavian artery cross the outer border of the first rib, enters the apex and comes into the axilla. Here. So this is the axillary artery. Axillary artery is a continuation of the subclavian artery at the outer border of the first rib. Now, if you can tell me what is this muscle? That's the medial lip of the bicipital tube, lateral lip of the bicipital tube. This muscle is the teres major. This muscle is the teres major muscle. Below the teres major, what is this artery now? Brachial artery. Brachial artery, right? Yes, brachial artery. Very good, very good. So axillary artery is a continuation of subclavian artery at the outer border of the first rib. Axillary artery continues as the brachial artery below the lower border of teres major. This is a very important landmark. Below the lower border of teres major, that's the coracoid process of scapula. And what is this muscle? The pectoralis minor. Pectoralis minor. So the pectoralis minor divides the axillary artery into three parts. Correct, bachcho? That's the first part. Behind the muscle is the second part, and that's the third part of the axillary artery. So axillary artery is divided into three parts by the pectoralis minor muscle. Relations of axillary artery are important. What are the branches of axillary artery? First part, one branch, superior thoracic artery. Second part gives two branches, lateral thoracic and thoracoacromial artery. And third part gives three branches, anterior circumflex humeral, posterior circumflex humeral, and the subscapular artery. Subscapular artery. Okay, just let me know. Now just let me know if it's clear. So what are the branches of axillary artery? First part, superior thoracic. Second part is lateral thoracic and thoracoacromial. And the third part gives anterior circumflex humeral, posterior circumflex humeral, and the subscapular artery. Subscapular artery. Fine, perfect. So that's about the axillary artery. The subscapular artery, agar ye subscapular artery hai, it gives a branch. Bacha, what is this branch known as? Any guesses? Any guesses, bacho? What is this artery? What is this branch known as? This is the subscapular. I'll mention this as the subscapular artery. This subscapular artery gives a branch. Any guesses? This artery passes through the upper triangular space. Come on, if you can answer this. This is what we call as the circumflex scapular artery. Very good. This is the circumflex scapular artery. And this circumflex scapular artery passes through the upper triangular space. It takes part in anastomosis on the dorsal aspect of scapula. Very good. Very good. Very good. Very good. Okay, we can quickly identify these muscles. This number one is the pectoralis major here, which is cut. Oh, sorry. This is the pectoralis major, which is cut here. This number 2 is the pectoralis minor, which is cut here. And this number 3 is the subclavius muscle. So that's the second part of the axillary artery. This is the first part, second part, third part. Clear? Okay. Now coming to the brachial plexus, we go through the brachial plexus. Yes, yes. Anastomosis with the, yes, Shantanu, very good. So anastomosis on the dorsal aspect of scapula is between the third part of the axillary artery and the first part of the subclavian artery, right? Now brachial plexus, how's the brachial plexus formed? It is formed by the ventral rami of C5 to T1. The ventral rami of C5 to T1. Sometimes C4 takes part in the formation of brachial plexus. What do you call this as? Prefixed. And sometimes T2 takes part in the formation, that is known as postfixed brachial plexus. Okay, so this is C5. Okay, I'll quickly go through this. C5, C6. Relations important है बच्चा, relations important है, relations important है. So I'll just tell you, relations important है. Posterior relations कौन है? Posterior relation is the posterior wall of axilla. Posterior wall. I'll tell you the brachial plexus, then I'll tell you the relations. ठीक है? Let me finish the brachial plexus. This is C5, C6, C7, C8 and T1. Relations you'll understand once you understand the brachial plexus. So what are these? What are these? These are the roots. Roots. In short, I'll tell you, relations, because that's a full lecture. Okay. Okay, so roots. So what are roots? Roots are the ventral rami of C5 to T1. The ventral rami of C5 to T1, that's roots. Roots will join to form what? Trunk. Trunk will divide into divisions. Divisions will join to form the cords. And the cords will give you branches. Okay. So roots, trunks, division, cords and nerves are the branches. I'll start. So C5, C6 joins to form, what is this? Upper trunk. C7 continues as the middle trunk. C8 and T1 joins to form the lower trunk. That's the lower trunk. So C5, C6 joins to form the upper trunk. C7 is the middle trunk. C8, T1 forms the lower trunk. What is the root value of upper trunk? C5, C6. Root value of middle trunk? C7. Root value of lower trunk? C8, T1. Now, each of these trunks will divide into a dorsal and ventral divisions. So this I draw as a dorsal division, dorsal, and ye hoga ventral divisions. So each of the trunk divides into a dorsal ventral divisions. Now, the ventral division of the upper trunk and the ventral division of middle trunk joins to form the lateral cord. The ventral division of lower trunk continues as the medial cord, and the dorsal division of all the three trunks joins to form the posterior cord. Clear? Yes. So joins to form the posterior cord. What is the root value? जितना mnemonic कम याद रख सकते हो उतना याद रखिए. Okay, just try to remember it like this. Very rarely try to understand the mnemonics. So what is the branch of lateral cord? I mean, what is the root value of lateral cord? It's C5, C6, C7. What is the root value of lateral cord? It's C5, C6, C7. What is the root value of medial cord? That's C8 and T1. And what is the root value of posterior cord? That's C5 to T1. Sare roots hote hain. All the roots, that's C5 to T1. Clear to all of you? Okay. Now, what are the branches of lateral cord? Branches of lateral cord. Number 1, lateral pectoral nerve. Second, lateral root of median nerve. Third, lateral, yes, and the third one is musculocutaneous. What are the branches of lateral cord? Lateral pectoral, lateral root of median nerve, and musculocutaneous nerve. What are the branches of medial cord? The medial pectoral, the medial root of median nerve, the medial cutaneous nerve of arm, the medial cutaneous nerve of forearm, and finally ulnar nerve. Yes, very good. And what is the root value of the posterior cord? I mean, what is the branches of posterior cord? Upper subscapular, lower subscapular, the nerve to latissimus dorsi, also known as thoracodorsal nerve, radial and axillary. This you should know. Brachial plexus should be on the tip of your tongue. So these are the branches of the cords of the brachial plexus. What are the branches from the roots of the brachial plexus? From the roots of the brachial plexus, uh, from the roots of brachial plexus, from C5. What is this nerve? Yes, anyone from C5? बोल सकते हो? What is the nerve which arises from C5 root of the brachial plexus? Come on, come on, come on, come on. The branch which arises from C5 root of the brachial plexus. Anyone? नहीं, long thoracic नहीं है. That's a nerve to rhomboids. That's a dorsal scapular nerve. Dorsal scapular nerve or the nerve to rhomboids. And this nerve to rhomboids is going to supply the levator scapulae, the rhomboidus minor and the rhomboidus major. Perfect. There's another nerve which arises from C5, C6 and C7. C5, C6, C7. That's the nerve to serratus anterior or the long thoracic nerve. Nerve to serratus anterior or the long thoracic nerve. Now, occasionally, sometimes there's a nerve which arises from C5 root. There's one more nerve which arises from C5 root. Any guesses? Any guesses? C5 se to dorsal scapular nerve is there already. But there's one more nerve which arises from C5 root of the brachial plexus. What is this? Any guesses? If you answer very well, longest कोला नहीं है, longest phrenic नहीं है बच्चा, phrenic नहीं है, it's a different nerve. Phrenic nerve का root value छावी, phrenic nerve का root value is C3, C4, C5. C3, C4, C5 is phrenic nerve, बराबर ना? But sometimes there's an extra phrenic nerve. Extra phrenic nerve. What do you call this as? Accessory phrenic nerve. Accessory phrenic nerve. And this accessory phrenic nerve arises from C5 root of the brachial plexus. Remember, the main phrenic nerve is C3, C4, C5. Barabar hai? Okay. So this is accessory phrenic. Excellent. Very good. Very good. Now, there are two branches which arise from the upper trunk. One is the suprascapular nerve. The second one is the nerve to subclavius. Suprascapular nerve and the nerve to subclavius. What does the suprascapular nerve supply? It supplies the supraspinatus and infraspinatus. And what is the nerve to subclavius supply? Subclavius. Okay, bacha? This is clear. That's the brachial plexus. Now, what are the parts of the brachial plexus? The roots. Look, the roots, the trunks, the division, cords, and nerves. Now, out of this, the roots, the trunks, and the divisions, where do they lie? They lie in the neck. They lie in the neck. The roots and trunks, they lie in the neck. Some books mention the divisions lie behind the clavicle. Behind the clavicle. Okay. So normally when we say the roots, trunks, and divisions, they lie in the neck. What lies in the axilla? In the axilla lies the cords and the nerves. So axilla mein kya hota hai? Cords and nerves. Okay. Now we know axillary artery is divided into three parts. Students, if this is the first part of the axillary artery, that's the second part of the axillary artery, and that's the third part of the axillary artery. I'll just in short tell you the relations. So, bacha, tell me now, in which part of the axillary artery do we get the cords, and which part of the axillary artery do we get the nerves? Come on, answer this. In which part of the axillary artery do we get the cords? We get the cords in the first part and the second part of the brachial plexus. We get the cords. First and second part, we get the cords. And in the third part of the axillary artery, what do we get? The nerves. The nerves, the branches. The branches. The cords of the brachial plexus. Dekho, axilla mein kya hai? Only cords and nerves. So out of this, the cords are present in the first and the second part of the axillary artery, and the nerves are present in the third part. The cords are placed according to the names in which part? Can anyone answer this? The cords are placed according to the names in which part? Who was asking me this? Uberman. Yes, tell me. The cords are placed according to the names in the second part of the axillary artery. In the second part of the axillary artery. Matlab, bacha, if that's the second part of the axillary artery, you know, this in short, I'll tell you. If that's the second part of the axillary artery, the cord which is lateral to the axillary artery is the lateral cord. The cord which is medial to the axillary artery is the medial cord. And the cord behind the axillary artery is the posterior cord. Clear? So you get the relations of the second part of the axillary artery. Lateral side by lateral cord, medial side is the medial cord, and behind is the posterior cord. And behind the posterior cord are those three muscles: subscapularis, teres major, latissimus dorsi. And in the third part, we will be getting what? The branches. Third part mein kya milega? Branches. So lateral cord, you'll be getting branches of lateral cord in the third part, the branches of medial cord and the branches of posterior cord in the third part. So anterior relation of axillary artery, pectoralis major. In the second part, pectoralis minor. Right? Clear? Fine. You get an orientation to this. See, because this is a revision, I'll just quickly touch the topics and go. If anything you need extra, I'll take a separate lecture. Okay, fine. Okay, so now coming to the arm now. Coming to the arm. Come on now, quickly. What is this muscle? Number one, this is the biceps brachii. And the biceps brachii has got two heads. This is what we call as the long head of the biceps brachii and the short head. The long head of biceps brachii arises from the supraglenoid tubercle of scapula. The short head of biceps brachii arises from the coracoid process along with the coracobrachialis. Short head arises from the coracoid process. Long head arises from the supraglenoid tubercle. You should be quickly able to recollect, revise this. Where is the insertion of biceps brachii? Where is the insertion of the biceps brachii? That's the head of the radius. That's the head of the radius. That's the neck of the radius. And what is this for the radius? That's the radial tuberosity. So where is the insertion of biceps brachii? It is inserted on the posterior aspect of the radial tuberosity. Posterior aspect of the radial tuberosity. What is the nerve supply of biceps? What is the nerve of this compartment? The musculocutaneous nerve. Musculocutaneous nerve. Yes. And what is the action of biceps? The main action of biceps is supination at the radioulnar joint. Supination in a mid-flexed elbow. In a mid-flexed elbow, supination is done by biceps. In an extended elbow, the supination is done by supinator muscle. Supinator muscle, right? So what is the action of biceps brachii? It's a chief supinator in a mid-flex position. It is a flexor of the elbow joint. It's a flexor of the shoulder joint. Yeah, that's about the biceps brachii. In addition, the long head of biceps brachii prevents the upward dislocation of the humerus. It prevents the upward dislocation of the humerus. Clear? Very good. Coming to the next muscle is number 2. That's the coracobrachialis. Number 3. That's the coracobrachialis. Origin, it arises from the tip of the coracoid process along with the short head of biceps brachii. Where is the insertion of coracobrachialis? Insertion is on the humerus. If that's the humerus here, we divide the humerus into two halves. It is inserted on the middle half of the shaft of the humerus. On which aspect? Yes, on the medial aspect. So where is the insertion of coracobrachialis? It is inserted on the medial aspect of the middle half of the shaft of the humerus. Medial aspect of the middle half of the shaft of the humerus, right? What is the action of coracobrachialis? It's a weak flexor. Of the shoulder joint. It's a very weak flexor of the shoulder joint. Coming to the next muscle, bacho. What is this muscle? Number 4. This is brachialis. What is the origin of brachialis? The origin of brachialis, it arises from the anteromedial and the anterolateral aspect of the shaft of the humerus below the insertion of coracobrachialis. But where the coracobrachialis ends, that is the beginning of brachialis. So it arises from the anteromedial and the anterolateral aspect of the shaft of the humerus below the insertion of coracobrachialis. Yes. Where is the insertion of brachialis, Pacho? Where is the insertion of brachialis? I'll draw this as the ulna here. And what is this for the ulna? The ulnar tuberosity. And this brachialis is inserted on the ulnar tuberosity. Insertion is on the ulnar tuberosity. What is the action of brachialis? It is a chief flexor of the elbow joint. It's a chief flexor of the elbow joint, right? That's brachialis. Perfect है? Which is the nerve, this compartment, the nerve is musculocutaneous nerve. Now, but you tell me, musculocutaneous nerve is a branch of which cord? Musculocutaneous nerve is a branch of lateral cord of brachial plexus. What is the root value of musculocutaneous nerve? That's C5, C6, C7. Root value is C5, C6, C7. This musculocutaneous nerve is going to pierce the muscle. That's a very important MCQ for you. That's a visual slide for you. That's a slide which is kept in the OSPE examination. Yes, the visuals. The musculocutaneous nerve is going to pierce a muscle. What muscle is that? The coracobrachialis. The coracobrachialis. Now, this musculocutaneous nerve is lying on this muscle. What is this muscle? The brachialis. And it lies below a muscle. It's the biceps. The nerve lies between two muscles. It lies between the biceps and the brachialis. And this nerve now continues as one. What is this? This is the lateral cutaneous nerve of forearm. It continues as the lateral cutaneous nerve of forearm. It supplies the skin on the lateral aspect of the forearm. Clear hai bachcho? Right? Are you able to correlate? You must be done with your prelims now. You must have revised everything. This is a quick, go through session. Perfect. Very good. Very good. Come on. Now, chalo. If you can answer this MCQ, I put one MCQ for you. Very good. Very good. बोलिए बच्चों बोलिए. Yes, Shantanu Kadam. Yes, all of you. Make it a attempt to answer this. Answer is musculocutaneous nerve. Very good. Very good. Numbness along the lateral aspect of the forearm. Okay, numbness along the lateral aspect of the forearm, which is the nerve, the lateral cutaneous nerve forearm. Yes, and it's a continuation of musculocutaneous nerve. It's a continuation of musculocutaneous nerve. Very good. Very good. Very good. So, this is an OSPE slide for you. Huh? Yes, visual slide for you. Tell me, what is this? What is this slide showing? Yes, Rahul, good evening. What is this slide showing? This is Erb's paralysis. Yes, Erb's paralysis. Abhi bolo bachcho. Erb's paralysis, injury to the upper trunk of the brachial plexus. What are the roots involved? C5, C6 roots of the brachial plexus are involved. And ye jo C5, C6 hai, they are mainly present in two nerves, mainly concentrated in two nerves. One is the axillary nerve and the other one is the musculocutaneous nerve. C5, C6 are present in many nerves, okay, but the main concentration is in the axillary and the musculocutaneous nerve. Now tell me, bacha, what is the axillary nerve supply? One is deltoid, and the second one is teres minor. Okay, axillary nerve supplies deltoid and teres minor. Deltoid is paralyzed, teres minor is paralyzed. So how would the arm be? Deltoid does abduction, so the arm is adducted. Abduction is lost. Teres minor does lateral rotation, so the arm is medially rotated. So how is the position of arm? Adducted and medially rotated, plus there's a loss of sensations on the upper lateral aspect of the arm. What is that? Regimen batch sign. Regimen batch sign. Perfect. The musculocutaneous nerve is involved. Musculocutaneous nerve supplies the biceps, the brachialis, coracobrachialis, and it supplies the skin. So the brachialis is gone. What is the action of brachialis? Extension. The action of brachialis is flexion. So flexion is lost, so the forearm is extended. Biceps is paralyzed. What is the action of biceps? Supination. So supination is lost, the forearm is pronated. And there's a loss of sensations on the lateral aspect of the forearm. When the arm and forearm is like this, the fingers becomes like this, and this is what we call as policeman's tip hand. Policeman's tip hand. So how is the position of arm? The arm is adducted, arm is medially rotated, plus regimen batch sign. The forearm is extended, the forearm is pronated, and there's a loss of sensations on the lateral aspect with policeman's tip hand. This is Erb's paralysis. Clear hai bachcho? Are you able to follow this? Yes? Answer this MCQ. All the following are seen in Erb's paralysis except. हाँ, answer this. Loss of flexion correct है. Loss of supination correct है. Loss of supination is correct, no? Loss of abduction correct है. अरे बच्चों, हाँ, answer is A. Answer is A. Loss of medial rotation. It will be loss of lateral rotation. No, it will be loss of lateral rotation. In fact, the arm is going to be medially rotated. Arm medially rotated ही होगा ना. There'll be no loss of medial rotation. There'll be a loss of lateral rotation. Are you able to follow this? बच्चों, MCQs ठीक से देखना. See the options properly. See the stem properly. Huh? I know you all must be knowing things perfectly. अरे बच्चे, प्रोनेशन होता है ना, प्रोनेशन होता है ना, so there is loss of supination. No, that is why there is pronation. बराबर बच्चा. supination, हाँ, प्रोनेशन होता है. That's right. प्रथम. Okay. Pronation क्यों? Why is there pronation? Because there is loss of supination. Right. Okay, very good. Chalo, great. Now, bachcho, tell me, what is this injury? That's Klumpke's paralysis. Injury to which trunk of the brachial plexus? Lower trunk of the brachial plexus, right? And which roots are involved? C8 and T1. And this C8 and T1 are mainly present in two nerves. One is the median nerve and the other one is the ulnar nerve. So C8 and T1 is mainly present in median and ulnar nerve, and this C8 and T1 are going to supply the intrinsic muscles of the hand, the small muscles of the hand. So what does the person get? The person gets a claw hand. Claw hand. The small muscles in the hand are gone, paralyzed, so the person gets a claw hand. Right. In addition, T1 carries sympathetic fibers. Yes, so the person gets a Horner's syndrome. Involvement of cervical sympathetics leads to Horner's syndrome. Yes, so again, very good. You've joined. Very good. Okay, that's great. Excellent. So this is Klumpke's paralysis. Remember this, bacho? A very important topic, Klumpke's paralysis. Yes, coming to the forearm. Yes, coming to the forearm. Now, we'll quickly go through the forearm, the superficial muscles in the forearm. Bacha, what is this? We'll start with the muscles. This is again an OSPI slide for you. So what is this? Number one, that's the pronator teres. Number two is the flexor carpi radialis. Number three is the palmaris longus. Number four is the flexor digitorum superficialis. And number five is the flexor carpi ulnaris. Flexor carpi ulnaris. So the first muscle is pronator teres. The next is flexor carpi radialis, the palmaris longus, the flexor digitorum superficialis, and the flexor carpi ulnaris. Now, snatch is now see. Flexor carpi ulnaris, right? Can anyone tell me what is this muscle? I put a star on this. What is this muscle? Any guesses? What is this muscle? वो associated movement है बच्चा. Gaurav, that's basal ganglia. These are associated movements. Why the upper limb moves? That is basal ganglia. These are known as associated movements. Yes, this is the brachioradialis. Brachioradialis, right? So this is the brachioradialis here. This is the pronator teres here, and this is the imaginary line joining the two epicondyles. This is the cubital fossa. So what are the boundaries of cubital fossa? The lateral boundaries formed by brachioradialis, the medial boundaries formed by the pronator teres, the base is formed by the imaginary line joining the two epicondyles. The floor of the cubital fossa is formed by two muscles. One is the brachialis and the supinator. Brachialis and supinator. Contents of cubital fossa: medial to lateral, the medial nerve, the brachial artery, the tendon of biceps, and the radial nerve. Some books mention superficial branch of radial nerve, right? So medial nerve, the brachial artery, the tendon of biceps, and the radial nerve. Yes, very good. MBBR. Right. Perfect. Now coming to the deep muscles. Can anyone tell me which are the deep muscles in the front of the forearm? The deep muscles is one. Okay, I'll just make a slide for you. This is the radius. That's the ulna. MBBR. So what is this muscle here? Superficial branch of radial nerve or radial nerve, you say. That's fine. So what is this? This deep muscle is the pronator quadratus. Pronator quadratus, right? The deepest muscle is the pronator quadratus. What is this muscle? These are the two muscles here. One is the flexor. Yeah, what is that? Flexor pollicis longus, flexor digitorum profundus. The muscle which begins from the radius, that's the flexor pollicis longus, and the muscle which begins from the ulna is the flexor digitorum profundus. And ये पांच superficial muscles, and these are the five superficial muscles here. This is the pronator teres, the flexor carpi radialis, the palmaris longus, the flexor digitorum superficialis, and the flexor carpi ulnaris. Flexor carpi ulnaris. Okay, so pronator quadratus सबसे deep. Above that is the flexor pollicis longus, the flexor digitorum profundus, and the five superficial muscles. Now, bacho, what is this nerve? Can anyone tell me what is this nerve and what is this nerve? This is the ulnar nerve, and what is this nerve? Median nerve. That's a median. So, what is the ulnar nerve going to supply? Chalo, bolo, what is the ulnar nerve going to supply? The ulnar nerve supplies one, the flexor carpi ulnaris, and the ulnar nerve is going to supply the medial half of the flexor digitorum profundus. Ulnar nerve is lying between what and what? Ulnar nerve is lying between the flexor carpi ulnaris and the flexor digitorum profundus. So ulnar nerve is going to supply the flexor carpi ulnaris and the medial half of flexor digitorum profundus. Clear hai? बाकी जितने भी muscles है, rest all the muscles would be supplied by whom? Median nerve. Rest all the muscles would be supplied by median nerve. Have a look. Now, this four muscles, the flexor, the pronator teres, flexor carpi radialis, palmaris longus, and the flexor digitorum superficialis, this is supplied by the median nerve. Okay, median nerve. And the median nerve gives a branch. Can anyone tell me what is this branch? And this branch is going to supply the flexor pollicis longus, the lateral half of profundus, and the pronator quadratus. What is this nerve? This is the anterior intraosseous nerve. Anterior intraosseous nerve is a deep branch of median nerve. Deep branch of median nerve. So, bacho, this is extremely important from practical point of view. When we discuss the median nerve and the ulnar nerve in the forearm, we will be saying the median nerve lies on the flexor digitorum profundus and the median nerve lies below the flexor digitorum superficialis. And the ulnar nerve is lying on the flexor digitorum profundus and below the flexor carpi ulnaris. So this we are going to write in the course of the median and ulnar nerve. Yes. Okay, clear to all of you? Nerve supply clear hai? So two muscles supplied by ulnar nerve in the forearm, flexor carpi ulnaris and the medial half of profundus. Four muscles supplied by the median nerve, and the deep branch of median nerve supplies the rest of the muscles, the flexor pollicis longus, the pronator quadratus, and the lateral half of profundus. So students, we've got a composite muscle here. The composite muscle is flexor digitorum profundus, supplied by two nerves. The second composite muscle was pectoralis major and pectoralis minor. The nerve supplies medial and lateral pectoral nerve. The third composite muscle is brachialis. Brachialis. The medial half is supplied by musculocutaneous nerve and the lateral half is supplied by the radial nerve. Brachialis. याद रखना, composite muscle. Brachioradialis नहीं है बच्चा. Brachioradialis is supplied by radial nerve. Brachialis है वो. Brachialis. Okay, that's good. Okay. Can anyone tell me to identify this OSPI slide for you? Come on, if you can quickly tell me what is this number 1, what is this number 2, and what is this number 3? Come on, bacho. Come on, quickly you answer. Okay, that's okay, bacha. That's okay. What is number 1? Okay, okay, बच्चा. What is number one? पहले ये देख लो, पहले lecture खत्म करते हैं. Number one is biceps brachii. You got this right. Very good. Biceps brachii. Number two is the brachialis. Very good, bachcha. Very good. Brachialis. Number three is the musculocutaneous nerve. That's awesome. That's awesome. So number one is the biceps brachii. We are in the arm. Number two is the brachialis. Number three is the musculocutaneous nerve. Bacha, the examiner is going to lift the biceps. And what are we going to see? The musculocutaneous nerve. Just remember this. Remember this. Okay, fine. Fine. Who's this number 4? Can anyone tell me what is this number 4 and what is this number 5? Number 4. Who's number 4? Number 4 is the median nerve, right? Number 4 is the median nerve. And who's number 5? Number 5 is the ulnar nerve. Very good. And if anyone can tell me what is this number 6? What's that number 6? Number 6 is the flexor carpi ulnaris. Number 6 is the flexor carpi ulnaris. And what's this muscle number 7? Number 7 का नाम बोलो. Number 7 muscle का नाम. What's 7? Number 7. Very good, Shantanu. You're also answering very well. Number 7 बोलो बच्चा. 7 नहीं है. No. Look, no. 7 muscle is the one in which the median and the ulnar nerve are lying on number 7. Who's number 7? It's the flexor digitorum profundus. 7 is profundus. 7 is profundus, bacha. 7 is profundus. What is this number 8? What is this number 8? Number 8. It's the lateralmost content of the cubital fossa. That's number 8. Who's that? That's a radial nerve. 8 is radial nerve. What is this number 9? Nerve and nerve. What is this number 9 and what is this number 10 nerve? Number 8 is radial nerve. Number 9, number 10 bones are number 9 and 10 are branches of the radial nerve. Bacho, these are the branches of radial nerve. The radial nerve divides in the cubital fossa. So what is this number 9? Number 9 is the superficial branch of radial nerve. And number 10 is the deep branch of radial nerve. Number 7 is the superficial branch of radial nerve. And that's a deep branch of radial nerve. What's the deep branch of radial nerve known as? What's the deep branch of radial nerve known as? It's the posterior intraosseous nerve. One moment. The deep branch of radial nerve is known as posterior intraosseous nerve. Right? That's a posterior intraosseous nerve. So superficial branch and the deep branch of radial nerve. Clear to all of you? Okay. 10 wala is the deep branch, bacha. 10 is the deep branch. And what is this number 11? If anyone can tell me what is this number 11? What is this number 11? Just one moment. The charging, getting charged. What is 11, bacho? Sorry. Okay, come on. What is this number 11? Can anyone tell me? प्रोनेटर टीरीज नहीं है बच्चा. ये प्रोनेटर टीरीज नहीं है. Number 11 is, that's a deep branch of radial nerve which is piercing it. The deep branch of radial nerve is piercing it. So what is that? That's a posterior, that's a supinator. Number 11 is the supinator. Supinator. Just one moment. This charging. There's no charging. Just one moment. Number 11 is supinator. You can have a look. Number 11 is supinator. Okay, I'm so sorry. Now 11 is the supine meter. Clear to all of you? Okay, I'll tell you the supine meter. Charger is not working. Okay, fine. This one. So, okay, we'll proceed. Now tell me better, what is this? This is a carpal tunnel. It's a carpal tunnel. Please tell me, what are the bones which takes part in the formation? These are the carpal bones. I'll just make this carpal bones for you. Uh, 1 to 10. 1 to 10. Ek minute. I'll tell you, just one moment. Okay, look here once again. Uh, number one is the biceps. Number one is the biceps. Number two is the brachialis. Number three is the musculocutaneous nerve. Okay. Number 4 is the median nerve. Number 5 is the ulnar nerve. Number 6 is the flexor carpi ulnaris. Number 7 is the flexor digitorum profundus. Number 8 is the radial nerve. Number 9 is the superficial branch of radial nerve. Number 10 is the deep branch of radial nerve. And the muscle 11 is the supinator. Supinator. Where does the supinator begin from? That's the radius. See, this is the radius. That's the styloid process of the radius. That's the ulna here. This is the styloid process of ulna. Now tell me, bacha, where does the supinator begin from? Can anyone tell me? The supinator begins from the ulna. There's a small crest there on the supinator, which is known as the there's a small crest on the ulna, which is known as the supinator crest. Supinator crest of the ulna. And this supinator begins from the ulna. It goes behind the radius. Okay, it goes behind the radius and it gets inserted on the lateral aspect of radius. Okay, very good. It begins from the supinator crest of the ulna. It goes behind the radius and gets inserted on the lateral aspect of the radius. So this muscle is the supinator. Clear? Okay, fine. Fine. Now coming to this carpal tunnel. Carpal tunnel. We'll start with the carpal tunnel. Just have a look at this. This are the carpal bones. These are the 4 carpal bones. 4 and 4. I'm just drawing 4 and the 4 is on the other side in front. Now, bacho, if this is medial and this is lateral, what is this which is covering the carpal bones? That's the flexor retinaculum. And this flexor retinaculum divides on the lateral side. The flexor retinaculum splits on the lateral side. It splits on the lateral side. Clear? It splits on the lateral side. Now, tell me, between the flexor retinaculum and the carpal bones, what is this tunnel which is formed here known as? That's the carpal tunnel. It's between the flexor retinaculum and the carpal bones. This is the carpal tunnel. Now, what is this structure which passes through the split of the flexor retinaculum? Can anyone tell me this? This is the flexor carpi radialis. Flexor carpi radialis. These are the 4 tendons of flexor digitorum superficialis. These are the 4 tendons of flexor digitorum profundus. And this is the tendon of flexor pollicis longus. Flexor pollicis longus. The tendon of flexor pollicis longus is enclosed in a bursa. What is this bursa? That's the radial bursa. That's the radial bursa with the tendon of flexor pollicis longus. Radial bursa with the tendon of flexor pollicis longus. The bursa which encloses the tendon of flexor digitorum superficialis and profundus. What is this bursa known as? This is the ulnar bursa. And this ulnar bursa encloses which tendon? This is a very, very important MCQ, bacho, very important MCQ. The ulnar bursa is going to enclose the tendons of flexor digitorum superficialis and the flexor digitorum profundus. Okay, flexor digitorum superficialis and profundus. And the radial bursa is going to enclose which tendon? It encloses the tendon of flexor pollicis longus. Flexor pollicis longus. Clear to all of you? Okay, and now you tell me, what is this structure here? What is this nerve here? What is this nerve? Can anyone tell me what is this nerve here? That's a median nerve. That's a median nerve, right? So median nerve encloses the tendons of, I mean, median nerve lies between what and what? The median nerve lies between the ulnar bursa and the flexor retinaculum. Between the ulnar bursa and the flexor retinaculum lies the median nerve. Okay, fine. Now you tell me, what is this tendon of? Look, the flexor retinaculum on the medial side sends an extension. The flexor retinaculum on the medial side sends an extension. What is this extension known as? This is known as the volar carpal ligament. This is known as the volar ligament. Okay, so the on the medial side, the flexor retinaculum sends an extension. What is that extension known as? The volar carpal ligament. And between the volar carpal ligament and the flexor retinaculum, we get a tunnel here. What is this tunnel known as? This tunnel is known as the Guyon's tunnel. Guyon's tunnel. Okay, bacho, what are the structures which are passing through the Guyon's tunnel? Can anyone tell me what are this structure passing through the Guyon's tunnel? Anyone? Structures passing to the Guyon's tunnel are the ulnar nerve and the ulnar artery. Ulnar nerve and the ulnar artery passes through the Guyon's tunnel. Okay. Ulnar nerve and ulnar artery passes through the Guyon's tunnel, right? Now, what is this tendon of? Sorry, that charger was not working. Sorry for the disturbance. What is this? What is this? What is this tendon? Come on, the tendon which goes above the flexor retinaculum. Any guesses? The tendon which goes above the flexor retinaculum. What is this tendon? Any guesses? That's the tendon of palmaris longus. That's the tendon of palmaris longus. Now, what is this? There's a nerve here, there's a nerve here, and there's an artery here. Bacho, can anyone tell me? What is this nerve known as? This nerve, I'll just write this for you. This nerve is known as the palmar cutaneous branch of ulnar nerve. And this is the palmar cutaneous branch of median nerve. And what is this artery? This is the superficial. This you should know. This you should know. Superficial palmar branch of radial artery. Superficial palmar branch of radial artery. My dear children, you get this MCQ, structures passing above the flexor retinaculum. So what are the structures going above the flexor retinaculum? Number one is the ulnar nerve and vessels. They pass through the Guyon's tunnel. Number two is the palmar cutaneous branch of ulnar nerve. Can anyone tell me what is this nerve going to supply? The palmar cutaneous branch of ulnar nerve supplies the skin over the hypothenar eminence. Hypothenar eminence. Then is the tendon of palmaris longus. Then is the palmar cutaneous branch of median nerve. What does this nerve supply? The skin over the thenar eminence. And finally, we have got the superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Clear to all of you? So this is the carpal tunnel. A very important diagram which is asked. And what is carpal tunnel syndrome? So compression of median nerve in the carpal tunnel is known as carpal tunnel syndrome. So whatever median nerve supplies in the hand will all be lost, except the skin over the thenar eminence are going to be intact. Okay, the skin over the thenar eminence are going to be intact. Clear, bacho? Fine. About this flexor retinaculum. Chalo, a short go through this. You tell me, what is this number 1, number 2, number 3, and number 4. Come on, answer this. Come on, bacho. Answer this. What is this? 1, 2, 3, 4. These are small muscles in the hand. These are the lumbricals. So the lumbricals arise from the tendons of, what are these tendons of? The flexor digitorum profundus. So the lumbricals है ये बच्चा, इंट्रोशन नहीं है. They arise from the tendon of flexor digitorum profundus, right? So the first and the second lumbricals are known as unipinnate. The first and second lumbricals are unipinnate. The third and the fourth lumbricals are said to be bipinnate. They arise from two tendons, no? So that is bipinnate, right? Now, bacha, where is the insertion of lumbricals? Can anyone tell me? The lumbricals are inserted on the palmar aspect of the lateral aspect of the base of the proximal phalanx of the fingers. Right, bacho, this is the proximal phalanx. This is the thumb. So which aspect would this be? Lateral aspect. So the first insertion of lumbricals is the lateral aspect. हाँ बोलता हूँ बच्चा बोलता हूँ. Palmar carpal tunnel syndrome you'll understand only if you understand the hand, है ना बच्चा? So this is the proximal phalanx. This is the lateral aspect, and this is the base of the proximal phalanx. So the lumbricals are inserted on the lateral aspect of the base of the proximal phalanx, and from here the lumbrical goes on the distal aspect, and they get inserted on the base of distal phalanx. Look, I'll just draw this bacho. I'll draw one finger for you. This is the proximal phalanx, that's the middle phalanx, and that's the distal phalanx. And ye proximal hai, ye middle hai, that's distal phalanx. So if this is lateral and this is medial aspect, where is the attachment of lumbricals? It's inserted on the base of the proximal phalanx of the fingers. It's inserted on the base of the proximal phalanx of the fingers, lateral aspect, and now it goes to the dorsal aspect and it is inserted on the base of distal phalanx of the fingers. Base of distal phalanx. Neat aspirant, samajh mein aaya ki nahi? I'm drawing. So look, what I've drawn one finger for you. This is the lateral aspect of the base of the proximal phalanx. And from here, ye piche jayega. It goes backside. It gets inserted on the base of distal phalanx of the fingers. Now is it clear? So what is the action of lumbricals? When this part contracts, it does this. What is this? Flexion at the metacarpophalangeal joints. And when this part contracts, what will it do? It will do extension at the interphalangeal joints. So what is the action of lumbricals? It does flexion at metacarpophalangeal joints and extension at interphalangeal joints. समझ में आया? Yes, neat aspirant, clear है? Pratham, fine. I hope this is clear to all of you. What is the action of lumbricals? Now, the first and the second lumbrical are supplied by which nerve? The first and the second lumbricals are supplied by median nerve. The third and the fourth lumbricals are supplied by the ulnar nerve. Yes, Rishi, Snejit, Shantanu, clear to all of you? Who all are there? Rest, all of you, Pratham. Fine, clear? This is clear? So the first and the second lumbricals are supplied by median nerve. The third and the fourth lumbricals are supplied by ulnar nerve. When these lumbricals are paralyzed, now what does the person get? What is the action of lumbricals? Flexion at metacarpophalangeal joints and extension at interphalangeal joints. Now when these lumbricals are paralyzed, we get a exactly opposite action, and this is what we call as a claw hand. So claw hand is due to paralysis of lumbricals. Clear to all of you? देखो ना, the first insertion clear है ना बच्चों? The first insertion is, this is lateral, no बच्चा, this is lateral and this is medial. So that's the base of proximal phalanx. So the first insertion is here on the lateral aspect, and then it goes to the dorsal aspect and gets inserted into the base of distal phalanx on the dorsal aspect. Yes, Anand? Very good. Anand is there. Good. Fine, clear to all of you. So that's about the lumbricals. Now coming to this muscles, can anyone tell me? This is an OSPI question. This is a visual slide for you, children. Tell me what is this? Number 1, number 2, number 3, and number 4. These are the muscles which arise from the bones. Any guesses? Bolta. I'll tell you. Just wait. Tell me what is this? What is this? Number 1, 2, 3, 4. These are the intrasci. And what intrasci this? Because this intrasci are arising from one bone. They're arising from the palmar they're arising from medial aspect of first and second, lateral aspect of third and fourth. What are these? These are the palmar intrasci, and this is what we call as unipinnate muscles. This is what we call as unipinnate. So palmar intrasci are unipinnate. Compared to this, what are these intrasci? This intrasci are arising from two bones. They arise from two bones like this. They arise from two bones. So what are these intrasci known as, bacho? These are what we call as the dorsal intrasci. Dorsal intrasci, right? So can you differentiate between a palmar intrasci and dorsal intrasci, bacha? The palmar intrasci are unipinnate. They arise from one bone, and dorsal intrasci are bipinnate. They arise from two bones. What is the action of palmar intrasci? Palmar intrasci does adduction of fingers, and dorsal intrasci does abduction of fingers. Dorsal intrasci does abduction of fingers. ठीक है बच्चों, clear? So palmar intrasci does adduction, dorsal intrasci does abduction of fingers. The palmar and dorsal intrasci all are supplied by whom? The palmar and dorsal intrasci are supplied by, any guesses? The palmar and dorsal intrasci are supplied by ulnar nerve. Ulnar nerve. The lumbricals, the first and the second, is supplied by median nerve. The third and the fourth is supplied by ulnar nerve. एक्सरे में इंट्राशय नहीं दिखेगा बच्चा. एक्सरे में बोन्स दिखते हैं ना बच्चे. एक्सरे में इंट्राशय मसल्स नहीं दिखते हैं. हाँ, एक्सरे में यू डोंट सी द मसल्स, यू सी ओनली द बोन्स. Perfect, बच्चों. Come on. Coming to the hand now. See, to understand the carpal tunnel syndrome, you should understand the muscles in the hand. Come on, students. Here I start. What is this eminence known as? The thenar eminence. What is this eminence known as? Hypothenar eminence. Who supplies the skin over the thenar eminence? The palmar cutaneous branch of median nerve. Who supplies the skin over the hypothenar eminence? The palmar cutaneous branch of ulnar nerve. And both these nerves were going above the flexor retinaculum, right? They were going above the flexor retinaculum. Now, what is this for the fingers? ये पूछते हैं, this is asked in surface anatomy, बच्चा. The actions of muscles are asked in surface anatomy. So what is this for the fingers? Even this I was asking my students also during the prelims exams. What is this for the fingers? Anyone? This is flexion for the fingers. What is this for the fingers? This is extension for the fingers. What is this for the fingers? Abduction. And what is this for the fingers? Adduction of fingers, right? Now, the first metacarpal bone, the thumb. The thumb is not in line with the other fingers. Thumb ऐसे नहीं होता है. The first metacarpal bone is turned by 90 degrees. It is rotated by 90 degrees. So the movements of the thumb would be at right angles to the fingers. This is extremely important. So what was this for the fingers? Abduction. What is this for the fingers? Adduction. So for the thumb, at right angles to this is abduction and this is adduction. Remember students, movements of the thumb are asked in the exams. So ये है abduction, ये है adduction, right? What was this for the fingers? Flexion. And what was this for the fingers? Extension. So for the thumb, this is going to be flexion and this is going to be extension. And what is this? क्या बोल रहे हो ऋषि? Okay, and what is this? Opposition of thumb. Opposition of thumb. So what are the movements of thumb? This is flexion, this is extension, this is abduction, this is adduction, and what's that? Opposition of thumb. Clear? Now what is this eminence? Thenar eminence. इसमें तीन muscles हैं. Small muscles, छोटे muscles हैं. So all the small muscles are known as intrinsic muscles. And all the small muscles will end with brevis. Like long muscles end with longest, no, bachcho. So short muscle will end with brevis. Okay, I start. Three muscles, two superficial, one deep. The first muscle does this. What's this, bachcho? Abduction. So what is this muscle? Abductor pollicis brevis. The second muscle does this. What's this? Flexion. So what is this muscle? Flexor pollicis brevis. And we remove this two. The third one is going to do this. Opposition. Name opponens pollicis. Opponens pollicis. So what are the muscles of the thenar eminence? Abductor pollicis brevis, flexor pollicis brevis. उसके दो heads है, superficial head and deep head. And the third one is opponens pollicis. So these muscles are supplied by median nerve. The thenar muscles, which abductor pollicis brevis. I'll just mention this for you. Look, abductor, short में लिखता हूँ मैं, abductor pollicis brevis, flexor pollicis brevis, the superficial head of flexor pollicis brevis, and the opponens pollicis. These three muscles are supplied by which nerve? Median nerve. And the first and the second lumbricals. The first and the second lumbricals. Okay. Okay, so this five muscles are supplied by median nerve in the hand, right? So median nerve supplies the abductor pollicis brevis, the flexor pollicis brevis, uska superficial head. The third muscle is opponens pollicis, and the first and the second lumbricals. So, bachcho, if there's a carpal tunnel syndrome is a compression of median nerve in the carpal tunnel. So, whatever median nerve supplies in the hand is all lost. So, these three muscles are paralyzed. The thumb, which is rotated by 90 degrees, now comes in line with the other fingers. This is seen in monkeys, and this is what we call as the ape thumb deformity. Ape thumb deformity, right? प्रथम बच्चा समझ में आ रहा है ना plus there'll be a claw hand of the index and the middle finger, claw hand, because first two lumbricals are paralyzed. So this is what we call as a partial claw hand. So when there's a carpal tunnel syndrome, this you'll be getting. Okay, these two lumbricals are intact. Plus the median nerve is compressed in the carpal tunnel. So what is the median nerve supply in the hand? It supplies the skin on the palmar aspect of 3.5 fingers. ठीक है ना, समझ में आ रहा है? Okay. Now coming to what are the muscles supplied by ulnar nerve in the hand. What is the ulnar nerve supply in the hand? Now bacha, what is this eminence here? Hypothenar eminence. Three muscles, two superficial, one deep. The first one does this. What is this? Abduction. So the name of the muscle is abductor digiti minimi brevis. The second muscle, बोलता हूँ बच्चा, बोलता हूँ. The second muscle does this. What is this? Flexion. So name flexor digiti minimi brevis. And the third one does this. What is this? Opponens digiti minima. So three muscles of the hypothenar eminence. Flexor digiti minimi brevis, abductor digiti minimi brevis, and opponens digiti minimi. तीन muscles हो गए. Two lumbricals, third and fourth. 5 हो गया. 4 palmar interossei, 4 dorsal interossei. All are supplied by ulnar nerve. 13 हो गए, 13. One deep head of flexor pollicis brevis, that is 14. And one muscle which does adduction of thumb. This is adductor pollicis. Yes, Nathan, adductor pollicis. So total of 15 muscles supplied by ulnar nerve in the hand. Ulnar nerve in the hand. Rishi, ये thumb है ना, first metacarpal bone is rotated by 90 degrees. In median nerve paralysis, in median nerve injury, the thumb becomes like this. This is seen in monkeys. It comes in line with the other fingers. That is known as ape thumb deformity. Here, bacha, 15 muscles supplied by ulnar nerve is clear. 3 muscles of hypothenar eminence, the 4th and 5th lumbricals, 4 palmar interossei, 4 dorsal interossei, the deep head of flexor pollicis brevis, and the adductor pollicis. So these are the 15 muscles supplied by ulnar nerve in the hand. And ulnar nerves, after supplying all these muscles, After supplying all these muscles, the ulnar nerve goes and ends in one muscle. This muscle is known as the graveyard of ulnar nerve. Yes, that's an MCQ, bacho. That's an MCQ. Can anyone tell me the graveyard of ulnar nerve? Who's this? ये कौन है graveyard of ulnar nerve? Any guesses? Ulnar nerve, after supplying this 15 muscle, goes and buries itself in this muscle. This muscle is therefore known as the graveyard of ulnar nerve. This is the adductor pollicis. Excellent. Very good to all of you. Very good. Adductor pollicis is known as graveyard of ulnar nerve. Just remember this. So with this, the anterior aspect gets cleared. So come on, can anyone tell me something about the median nerve? Chalo bolo bacha, median nerve. How is the median nerve formed? Ek minute, quickly I'll go through it. Look, this is the axillary artery. This is the pectoralis minor. A quick go through the median and ulnar nerve. Okay. This is the teres major. That's a teres major. That's a pectoralis minor. Okay, bacho, come on. If you can tell me now, who's this and who's this? If you can tell me who's this and who's this. This is the lateral cord. That's a medial cord. This is the musculocutaneous nerve. And who's this? And therefore, who's this? And thus, who's this? Come on, can you answer this? ये PDF मिल जाएगा. Writing I can't write because it takes a lot of time. So that's how the median nerve is formed. Bacha, can anyone tell me what is this? This is the lateral root of median nerve. What is this? This is the medial root of median nerve. Medial root of median nerve. So median nerve is formed by two roots. One is the lateral root of median nerve and the other one is the medial root of median nerve. But which root is longer? Which root is longer? The medial root of median nerve is longer. It crosses the axillary artery. It goes to the lateral side. It joins with the lateral root and thus the median nerve is formed. So when the median nerve is formed, where is the median nerve with respect to? Where is the median nerve with respect to the axillary artery? It's lateral to the third part of axillary artery. Yes, ab likhna aapko. So when the median nerve is formed, it is formed lateral to the third part of the axillary artery. Now this median nerve is going to cross the brachial artery. The median nerve crosses the brachial artery from which side to which side? Which side to which side? From the lateral side to medial side. Ye dekho. The median nerve crosses the brachial artery from the lateral side to the medial side. Where are we? Come on. Answer this. Where are we? That's the pronator teres. That's the brachioradialis. So where are we now? We are in the cubital fossa. So the median nerve crosses the brachial artery from the lateral to the medial side. The median nerve now comes in the cubital fossa. This is the brachial artery and with its two branches, this is the ulnar and the radial artery. Barabar hai? This is the head of the radius. Okay, and what is this muscle? That's a biceps. And the last nerve which comes here, that's the radial nerve. So this becomes a cubital fossa. So median nerve explain karte na bacha, you have to explain it like this. You have to draw these diagrams. The more the diagrams you draw, the more your size of answer increases, right? So first, how is the median nerve formed? By the lateral root and the medial root. The medial root is longer, goes to the lateral side, joins with the lateral root. So the median nerve is formed lateral to the axillary artery. The median nerve crosses the brachial artery. Ab ye cubital fossa mein aa gaya. How does the median nerve leave the cubital fossa, bacha? Can anyone tell me? The median nerve passes between the two heads of, here we are, the pronator teres. So median nerve passes between the two heads of the pronator teres, and the moment it crosses the pronator teres, ab ye kaha hai? It's in the forearm. It's now in the forearm. In the forearm, it gives a deep branch. What is this deep branch known as? The anterior introitious nerve. The median nerve in the forearm lies on which muscle? That's the flexor digitorum profundus. And below which muscle? That's the flexor digitorum superficialis. ये मैंने दिखाया ना, I've shown you this. So in the forearm, okay, that's fine. That's fine. So median nerve in the forearm lies on what? The flexor digitorum profundus, and it lies below what? It lies below the flexor digitorum superficialis. In the forearm. In the forearm, the median nerve gives a deep branch, right? The anterior intraosseous nerve. So what are the muscles supplied by the median nerve in the arm? This was a Viva question which I was asking my students in the college also. Name the muscle supplied by median nerve in the arm. And the student just starts to think, arm mein, oh, what were the muscles? What were the muscles? Biceps? Biceps? Brachialis? No! Biceps, the brachialis, these are all supplied by the musculocutaneous nerve. So, does the median nerve supply any muscle in the arm? No. No, the median nerve does not supply any muscle in the arm. You should be confident enough to answer this. In the forearm, the median nerve supplies what? The four superficial muscles, pronator teres, the flexor carpi radialis, the palmaris longus, the flexor digitorum superficialis. And the median nerve gives a deep branch, the anterior intraosseous nerve, which supplies the lateral half of profundus, the flexor pollicis longus, and the pronator quadratus. The median nerve now comes to the wrist. The median nerve enters the hand through the carpal tunnel, and the median nerve then supplies 5 muscles in the hand. Clear a course of median nerve, बच्चों? I'm just giving an orientation, just trying to correlate things. Okay. Clear with the median nerve? Now, tell me the ulnar nerve. Coming to the ulnar nerve. Where is the ulnar nerve? Ulnar nerve is a branch of which cord? Ulnar nerve is a branch of medial cord. Very good. Very good. Ulnar nerve is a branch of medial cord. Yeah. The ulnar nerve is a branch of medial cord. Yes. Yes. बच्चों, the ulnar nerve is lying between what and what? See, ये axillary artery है बच्चा. And who's this? Who's this by the side of axillary artery? That's the axillary vein, right? Which is this cord here between the axillary artery and the vein? That's a medial cord, medial cord. So the ulnar nerve is between the axillary artery and the vein. You understanding this? So if I draw this as the axillary artery, I draw this as the axillary vein. So this is our ulnar nerve, and there's someone lying over the ulnar nerve. Can anyone tell me this? Who's lying on the ulnar nerve between the axillary artery and the vein? Who's this? That's a medial cutaneous nerve of forearm. समझ में आ रहा है बच्चा ये? So there are two nerves between the axillary artery and the vein. कौन है दो? One is the ulnar nerve and the second one is the medial cutaneous nerve forearm. Radial nerve बच्चा पीछे होगा ना? Radial nerve will be backside. Radial nerve is related to the third part of the axillary artery on the posterior aspect, बच्चा. Posterior है ना? It's a branch of posterior cord, no बच्चा? Clear hai? So I'm coming to the ulnar nerve. Ulnar nerve, it's a branch of medial cord. The root value of ulnar nerve is C7, C8 and T1. C7, C8 and T1. The ulnar nerve lies between the axillary artery and the axillary vein with the medial cutaneous nerve of forearm above it. The medial cutaneous nerve of forearm is over it. Now this ulnar nerve is going to pierce a septum. here. Okay, I'll just make it like this for you. The ulnar nerve is going to pierce a septum here. Any guesses? What is this? This is what we call as the medial intermuscular septum. So ulnar nerve will pierce the medial intermuscular septum and go behind the medial epicondyle. Ulnar nerve kidhar hai bacha? Ulnar nerve is behind the medial epicondyle. No, how does the ulnar nerve go backside? So the ulnar nerve is going to pierce the medial intermuscular septum. What is medial intermuscular septum? बच्चों ये humerus है ना, look, that's a humerus here. So the humerus on the medial side and on the lateral side, there's a deep fascia, and this is what we call as the medial and the lateral intermuscular septum, right? So the ulnar nerve pierces the medial intermuscular septum along with an artery. Can anyone tell me the name of the artery? Come on. That's an MCQ. Ulnar nerve pierces the medial intermuscular septum along with an artery. Any guesses? Come on, come on, come on, bachcho, come on. You can answer this. Ulnar nerve pierces the medial intermuscular septum along with an artery. Any guesses? Huh? नहीं नहीं बच्चा profunda brachii नहीं, profunda brachii नहीं. Profunda brachii goes with radial nerve, no? Profunda brachii goes with the radial nerve. It's the superior ulnar collateral artery. That's an MCQ for you. So the ulnar nerve along with the superior ulnar collateral artery is going to pierce the medial intermuscular septum. Superior ulnar collateral artery pierces the medial intermuscular septum, goes behind the medial epicondyle. Now the ulnar nerve comes in the forearm. Ulnar nerve comes in the forearm. The ulnar nerve is lying on which muscle? Bolo bachcho, you know this. Ulnar nerve is lying on which muscle? Flexor digitorum profundus, and below which muscle? Flexor carpi ulnaris. So the ulnar nerve is lying in the forearm on the profundus below the ulnaris. The ulnar nerve supplies the flexor carpi ulnaris and the medial half of profundus. The ulnar nerve enters the hand through the Guyon's tunnel and then divides into branches. It supplies 15 muscles in the hand. Clear? Is this clear to all of you, bachcho? Is this clear? Chalo, perfect, perfect. So that's about the median of the ulnar nerve that you can now write in details. Okay. Chalo, answer this now. So that's the scapula, that's the humerus. Tell me, what is this muscle? Just a small part left. Just a small part left now. I'll finish this. This is, what is this muscle? Any guesses? Any guesses? What is this muscle? What is this muscle? And what is this muscle? Coracobrachialis नहीं है बच्चा, ये coracobrachialis कैसे होगा? Just try to understand this. Try to understand. Yes, bachcho, come on, come on, come on. Try to guess this muscle and learn to draw diagrams, sir. Diagrams draw karo, bachcho. What's this? Okay, so this is the lateral head of triceps. This is the medial head of triceps. That's the long head of triceps. And what is this? Olecranon process. Olecranon process. Clear to all of you? Short head नहीं होता बच्चा, short head नहीं होता ना. One is the long head of triceps which arises from the infraglenoid tubercle. The lateral head of triceps arises above the spiral groove, and the medial head of triceps arises from the shaft below the spiral groove. All the three heads of triceps, they join together and they are inserted on the olecranon process of ulna. What is the action of all this heads of, what is the action of triceps? They cause extension at the elbow joint. Extension at the elbow joint. The long head also causes extension at the shoulder joint. Long head causes extension at the shoulder joint. Fine? Clear to all of you? So, now you tell me the radial nerve. If you can answer this, radial nerve. Now come on, bachcho, radial nerve. I'll just tell you in short, radial nerve. Radial nerve is a branch of which cord? Radial nerve is a continuation of the posterior cord. Posterior cord. What is the root value of radial nerve? The root value of radial nerve is C5 to T1. Radial nerve C5 to T1. So radial nerve is first in the axilla. Okay, radial nerve is first in the axilla. From the axilla, it goes in the spiral groove. Spiral groove. From the spiral groove, it comes on the lateral aspect of the arm. lateral aspect of the arm, and finally it goes in cubital fossa. Finally, it goes in the cubital fossa. So these are the four parts of radial nerve. Just in short, I'll tell you. So if I draw this as the humerus, chalo bachcho, tell me quickly, what is this muscle arising from the anterior aspect of the shaft of the humerus? If this is medial and this is lateral, what is this muscle which arises from the anterior aspect of the shaft of the humerus? Brachialis. Okay, that's the medial epicondyle, that's the lateral epicondyle. This is the medial supracondylar ridge, that's the lateral supracondylar ridge. Two muscles are arising from here. Can anyone tell me what are these two muscles? The brachioradialis and the extensor carpi radialis longus, right? So the brachialis arises from the anterior aspect of the shaft of the humerus. From the lateral supracondylar ridge, two muscles are there. One is the brachioradialis and the other one is the ECRL, extensor carpi radialis longus. So our radial nerve is first in the axilla. That's Roman number 1 in the axilla. Then the radial nerve enters into this groove here. What is this groove? Number 2 is the spiral groove. Then the radial nerve turns and comes here. What is this? The lateral aspect of the arm. And then it goes here. What is this going to be now? That's the cubital fossa. A brachioradialis, that's the pronator teres, that's the cubital fossa. Yeah, bacho. So I've just told you in short the course of radial nerve. Radial nerve is first in the axilla. Axilla, so it goes in the spiral groove. Then it comes on the lateral aspect of the arm, and finally it comes in the cubital fossa. Now you tell me, bacho, what are the branches of radial nerve in the axilla? In the axilla, it gives two muscular branches and one cutaneous branch. In the spiral groove, it gives three muscular branches and two cutaneous branches. This is the easiest way to remember. So two muscular branches are given to the long head and the medial head of triceps. Long and the medial head of triceps. One cutaneous branch, इसका नाम है posterior cutaneous nerve of arm. Posterior cutaneous nerve of the arm. This is extremely important. What are the branches of radial nerve in the axilla? Two muscular, one cutaneous. Muscular branches, the long head of triceps, the medial head of triceps. Two branches. One cutaneous branch, that's the posterior cutaneous nerve of arm. Perfect. Now come in the spiral groove, it gives three muscular branches. Three muscular branches to the lateral head of triceps, to the medial head of triceps, and the third is to the anconeus. बस ऐसे याद रखना, lateral head of triceps, medial head of triceps, and anconeus. So बच्चों, the medial head of triceps receives nerve supply twice, once in the axilla, once in the spiral groove. Clear है? So the medial head of triceps receives nerve supply twice, once in the axilla, once in the spiral groove. Why? Because the medial head of triceps is a large head. It's a very big head. Two cutaneous branches. One is the posterior cutaneous nerve of forearm, posterior cutaneous nerve of forearm, and the lower lateral cutaneous nerve of arm. Posterior cutaneous nerve forearm and the lower lateral cutaneous nerve arm. Upper lateral cutaneous nerve arm is a branch of which nerve? Axillary. So this is the lower lateral cutaneous nerve arm. ठीक है, बस ऐसे याद रखना. Lateral aspect of the arm, it supplies three muscles. One is the brachioradialis, the extensor carpi radialis longus, and third is brachialis. Brachialis, lateral half. Okay, see, lateral aspect of the arm, it lies between what and what? It lies between the brachioradialis, ECRL, and the brachialis. So it supplies these three muscles. And then in the cubital fossa, it divides into two branches. One is the superficial branch and one is the deep branch, right? Superficial branch and deep branch. Deep branch is known as the posterior interosseous nerve. The posterior interosseous nerve supplies all the deep muscles in the back of the forearm. Posterior interosseous nerve supplies all the deep muscles in the back of the forearm. The superficial branch of radial nerve is sensory. It is sensory. It supplies the skin on the dorsum of the hand and the proximal phalanges of 2.5 fingers. The superficial branch of radial nerve is sensory. It supplies the skin on the dorsum of the hand and the proximal phalanges of lateral 2.5 fingers. Students, clear hai bacha? In short, I've told you the radial nerve. Are you understanding this? I've told you the entire radial nerve in 5 minutes. Hello, bachcho. Clear hai? Is this clear? Yes, answer. Yes, boomer. Booger. Okay, perfect. Clear, no? Fine. So injury to the radial nerve, थोड़ा सा elaborate करना पड़ेगा ना बच्चा. You have to elaborate it. I'm just giving you. See, this is how you remember. Because pura BDC to read it on the previous day is going to be difficult, right? So you just remember the important points, right? Like in the axilla, yes, what is the radial nerve supply? So and then usko elaborate karna na. LAQ has to be at least 3 to 4 pages. So you have to write, you have to draw diagrams, you have to write. ऐसे लिखोगे ना, that is fine. Posterior interosseous nerve. Posterior interosseous nerve. What is the posterior interosseous nerve supply? The posterior interosseous nerve supplies. One moment. The posterior interosseous nerve supplies. Yes. What do we start with? Extensor carpi radialis brevis. Extensor digitorum. Extensor digiti minimi. Deep muscle. Extensor carpi देखो brachioradialis and extensor carpi radialis longus is supplied by whom बच्चा? Radial nerve. So what is left now? Extensor carpi radialis brevis, extensor digiti minimi, extensor carpi ulnaris. These are the superficial muscles. The deep muscles would be abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and the supinator. Clear, Snehajit बच्चा? Supinator. I hope this is clear to all of you. See, forearm के superficial muscles क्या है? Brachioradialis, extensor carpi radialis longus, that is supplied by radial nerve. दूसरा है anconeus, that is supplied by radial nerve in the spiral groove. अब बचे कौन है? Who's left? The extensor carpi radialis brevis, the extensor digitorum, the extensor digiti minimi, extensor carpi ulnaris, and the deep muscles. Clear, बच्चा? Abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and supinator. Out of this, these two muscles are going to form the lateral boundary, and this is going to form the medial boundary of the anatomical snuff box. Here we go to the anatomical snuff box. Bacho. So what is this muscle? This is the abductor pollicis longus. This is the extensor pollicis brevis. This is the extensor pollicis longus. So, right. So, the lateral boundary of the snuff box is formed by two muscles, the abductor pollicis longus and the extensor pollicis brevis. The medial boundary is formed by extensor pollicis longus. The floor, बोल सकते हो, floor is formed by styloid process, scaphoid and trapezium. The floor of the anatomical snuff box is formed by the styloid process of radius, the scaphoid and the trapezium. Who's the content of the snuff box? Content बोल सकते हो? Content is the radial artery. And who's in the roof of the snuff box? In the roof is the cephalic vein and the superficial branch of radial nerve. That's the superficial branch of radial nerve. Deep branch of radial artery nahi hai, it's a radial artery. Radial artery hai bachcha, that's a superficial branch of radial nerve. Clear? So simple hai, snuff box clear hai. The lateral boundary is formed by the abductor pollicis longus and the extensor pollicis brevis. The medial boundary is formed by the extensor pollicis longus. The floor is formed by the styloid process of radius, scaphoid and trapezium. The content, radial artery. The roof is formed by the skin, superficial fascia containing the cephalic vein and the superficial branch of radial nerve. So, which is the bone which is very commonly fractured in the snuff box? Bolo. Yeah, this is the basis of clinical MCQ. The person meets with an accident. that is in the hand. बच्चा radial nerve divides in the hand into a superficial and deep branch. Snuff box में radial artery है, which is the bone which is fractured in the snuff box scaphoid. बच्चा ये याद रखना, the bone which is very commonly fractured in the snuff box is the scaphoid. Excellent, very good बच्चों. Okay, I'll just draw a slide for you and we'll come to an end of this lecture now. Can anyone tell me this? चलो बच्चों, ये कौन है? What is this muscle? What is this muscle? And what is this muscle? चलो बोलो. What is this muscle? So this is teres minor. This is teres major, and that's the triceps. So what is this number 1? What is this number 2? And what is this number 3? Yes, number 1. Yes, bacho, number 1 is the upper triangular space. Number 2 is the lower triangular space. And number 3 is the quadrangular space. Clear? So what are the boundaries of upper triangular space? The teres minor, the teres major, and the long head of triceps. And who's the content here? The circumflex scapular artery. Okay, that's the circumflex scapular artery. Lower triangular space, what is that? Teres major, the long head of triceps, and the shaft of the humerus. What lies here is the spiral groove, and the content is the radial nerve and the profunda brachii artery. Radial nerve and the profunda brachii artery. Clear? Yes, Hemant, very good. And third is the quadrangular space. What are the boundaries? Teres minor, teres major, the long head of triceps, and the neck of the humerus. And who's the content? Content is the axillary nerve and the posterior circumflex humeral artery. Axillary nerve and the posterior circumflex humeral artery. Clear, bachcho? So spaces are clear. A very important short note MCQ comes on this. Okay, so that's about the spaces in the arm. And coming to the last one, the spaces of the hand. So tell me now, this is the thenar eminence. That's the hypothenar eminence. These are the metacarpal bones. That's the palmar aponeurosis. We draw a septa from the palmar aponeurosis to the third metacarpal bone. This septum drawn from the palmar aponeurosis to the third metacarpal bone divides the spaces in the hand into two parts. One is what we call as the thenar space, and this is what we call as the mid-palmar space. A thenar space and a mid-palmar space. What are these? These are the flexor digitorum superficialis tendon. These are the tendons of flexor digitorum profundus. These are the lumbricals. 1, 2, 3 and 4 lumbricals. So what is this space? Dekho bachcho, what is this space? This is the thenar space. What are the boundaries of thenar space? This is the thenar eminence here. This is a septum drawn from the palmar aponeurosis to the third metacarpal bone. And what does the thenar space contain? The thenar space contains the first tendon of flexor digitorum superficialis, the first tendon of flexor digitorum profundus with the first lumbrical. What are the contents of mid-palmar space? Mid-palmar space ke contents is the second, third and fourth tendons with the rest of the lumbricals. So these are the thenar and mid-palmar spaces in short I've told you. Thenar space ka content is the first tendon of superficialis and profundus and the first lumbrical. Some books mention the second lumbrical too. The content of the mid-palmar space is the rest of the tendons and the lumbricals. Second lumbrical thenar space में लिखते हैं, thenar space. Shoulder joint. Okay, I'll just tell you what is the type of joint. Bachcho, shoulder joint. What is the type of joint? The ball and socket type of synovial joint. What are the bones which takes part in the formation of joint? One is the head of the humerus and the glenoid cavity. Now the glenoid cavity is very shallow, whereas the head of the humerus is large. So the chances of dislocation are very common in shoulder joint. But The stability is less, but the mobility is very high in case of shoulder joint. So, what are the factors which maintain the stability of the shoulder joint? Number one is this glenoid cavity is made deep by a rim of fibrocartilage. What is the rim of fibrocartilage? Known as glenoid labrum. That is known as the glenoid labrum. So glenoid labrum होता है. ये glenoid labrum कहाँ पे होता है? It's on the border of the glenoid cavity. So ये जो glenoid labrum है, it makes the glenoid cavity deep. Okay. The second one is if you see the humerus, बच्चा, look, this is the humerus like this. This is, yeah, ना. Okay, tell me now, what is this? This is the bicipital groove. And this bicipital groove, यहाँ पे एक ligament होता है. What is this ligament known as? This is the transverse humeral ligament. Transverse humeral ligament, right? What else is there? There is the coracohumeral ligament from the coracoid process to the humerus. And the last one is the capsular ligament. How is the capsular ligament attached to? The capsular ligament is attached to the margins of the glenoid cavity, and the capsular ligament is attached around the head of the humerus. It is deficit superiorly for the tendon of the biceps to pass. The capsular ligament is attached to the anatomical neck of the humerus, and on the medial side it goes to the surgical neck. It goes to the surgical neck. Clear? Here, students, so one is the capsular ligament attached to the margins of the glenoid cavity. Secondly, it is attached to the anatomical neck of the humerus, except on the medial side it goes to the surgical neck. Superiorly, the capsule is deficit for the tendon of biceps to pass. With the other ligaments, you have to write the coracohumeral ligament, the transverse acetabular ligament, the transverse humeral ligament, and uh, the glenoid labrum. Then you have to write the muscles, the relations, anterior, posterior, superior, inferior, the movements, the flexion, extension, abduction, adduction, and the muscles causing the movements. And finally, you have to write the blood supply, the anterior and posterior circumflex humeral arteries. The nerve supply is the axillary nerve, the musculocutaneous nerve, and then clinical anatomy. You have to write about dislocation of the shoulder joint is very commonly inferiorly. When there's an inferior dislocation, the axillary nerve gets damaged. Dear students, I hope I've tried to cover most of the topics in this short span. I hope things are clear to all of you. We'll continue with this FARRE series. Upper limb was a short topic. Next, we will start with thorax. SN will finish the topics in FARRE series. Thank you to all of you, my dear students. Thank you. Meet you on Thursday with thorax. Thank you. तो लेक्चर स्टॉप कर देना, यहाँ से नहीं हो रहा है।